Okay, the next test we're going to be performing is the straight leg raise test. This test specific to these skills are to test hamstring length, hamstring flexibility. So what we're going to have the patient do is go ahead and lie on their back. From this position, all I'm going to do is go ahead and raise the patient's leg, keeping the knees straight all the way up. I want to be sure the patient doesn't dorsiflex because specifically here we're testing for muscle length, not nerve tension. From this position, I'm going to have the patient hold that knee straight as much as they can, and I'm going to line the goniometer in line with the patient's mid-axillary line, and my other arm will be in line with the patient's greater trochanter, with the center of it being at the hip. From there, I'm going to have the patient go ahead and relax, and I'm going to go ahead and check the angle of the hip. For Chase, this is specifically 110 degrees, which means Chase came 70 degrees off of the table with his hamstrings. I would consider this a restricted range of motion of the hamstring length. We're going to perform the same thing on the other side. So what I'm going to have Chase go ahead and do is the same thing as before. I'm going to have him keep the knee straight. I'm going to go ahead and have him lift the leg up. I'm going to have him relax the foot, and I'm just going to have him hold here while I measure the angle from his mid-axillary line, and then the other arm of the goniometer in line with his greater trochanter. And I'm going to have him go ahead and relax. For Chase, this one was a little bit more restricted at 108, which means he has 68 degrees of flexion off of the table, and I would consider this a positive test for restricted hamstring